What does it take to advocate effectively for ourselves and our loved ones as we navigate the complexities of aging and healthcare? Today, this conversation merges passion with expertise as we explore caregiving, healthcare, advocacy. This is where we are having a meaningful discussion. My guest today is Cheryl Field, a seasoned professional with over 3 decades in nursing, specializing in rehabilitation and post-acute care. Her journey in the healthcare industry is not just about professional milestones, it is a testament to a lifelong commitment to quality, compliance, and patient advocacy. With roles ranging from clinical director to chief product officer, and her voice through state and national conventions, Cheryl brings a wealth of information and a unique perspective to our conversation today. Cheryl is a two-time international best-selling author whose recent book, Prepared: A Healthcare Guide for Aging Adults, offers a simple yet powerful system of advocacy that anyone can follow. Her approach simplifies complex systems with analogies and personal stories, making these daunting topics accessible and engaging. We talk about how we foster independence and not dependence, what essential questions we should be asking ourselves to ensure we're providing the best care possible, how we understand healthcare costs and Medicare, managed care, and all of those questions we have about navigating the healthcare system, and how we can fill in those gaps, how we are supported in our caregiving, and how we can put systems in place that support our caregiving. Cheryl shares complex information in a way that is easy to understand and learn, and through personal story. Here is my interview with Cheryl Fields. Hi, Cheryl. This is going to be really fun. You have such a wealth of knowledge, and you are able to share that with all of us. So, looking forward to it. Thank you for being here.
Oh, thank you for having me, Nicole. Again, I completely agree. I've been looking forward to this day for a few months now.
Looking forward to it. I know we're going to cover, oh my gosh, a little bit of a variety, but really focusing on how do we empower caregivers? How do we find access to information that can be really, really helpful? And you have your own experience in caregiving. And not only that, but you're in the healthcare profession. So it's this like beautiful uh, connection of the two. So really looking forward to diving in. So I'm so curious to learn a little bit more about you and your background. How did you start in this caregiving advocacy space? What led you to want to now educate others on that?
You know, I think it's interesting where our paths begin in life, right? And honestly, as a small girl, I was 10 or 11 years old. I had a grandmother who lived 500 feet from our home, and in between, a neighbor who was also older. And I really began, if you really think about it, as a caregiver by doing little things for each of those persons in my neighborhood. And I even remember I used to sit on the front lawn and do like cartwheels and do little different entertainment things while my neighbor would go grocery shopping. And I now know, later I learned that, her sister had Parkinson's, and she would run to the grocery store while I was entertaining her sister on the front lawn. She'd
Mm.
come back from the grocery store and she'd give me a butterscotch, and I would open the garage door because, those days we didn't have openers. I'd open the garage door. She'd give me a little piece of candy. I was thrilled. But I really had a heart for it, I think, at an early age.
Mhm.
Although when I went to college, it wasn't to be a nurse. I was really going to go into medicine. And, I had my eyes set on medical school or chiropractic school. And I made my way into a nursing program, which has really been the best for me. But coming into the role of caring for others really happened for me early on. And I did some home care work, not as a certified nursing assistant, but just as a companion to seniors, even when I was in high school. So it's definitely something that I've been called to do from an early age
Mm.
and continue to be in that role today.
So you went into nursing. What motivated you to decide to go on, pursue higher education? You share a little bit about the challenges of being raised by a single mom, right? So overcoming some of that. Tell us more about that.
Yes, I as I said, I went to college and I really planned to, go into medical school. The reality of affording education beyond even undergraduate was very real for me. My parents were divorced. My mother, raised four of us. She was a single parent, worked really hard, and modeled for us that we could do anything. So I had great confidence. The reality is that, beyond the first year of university, I was starting to face, rising costs and loans. And so I I was quite content to have my undergraduate in nursing and come out and be working. But I will share that my university advisor, and maybe all of them make this recommendation, encouraged all of us to pursue a master's, to think about higher education. In anything clinical, really in so many professions, you have to be a lifelong learner. You cannot stop learning. Medicine has changed, healthcare has changed, technology changes. So you're constantly learning. They instill that in you in undergraduate years. So I did know that I'd want to pursue a master's in nursing. I ended up doing that in Boston College within 2 years of graduating. And being a person who always wanted to get ahead of illness, I did that in adult ambulatory care, where the focus was really on, health promotion and illness prevention. Right.
Mm.
Let's just get upstream of these things and not have these kinds of illnesses come on. So that's the area of nursing where, I pursued that higher education. And I think when you think about health promotion, already you start with a lot of advocacy. You're really trying to compel human individuals to change their behaviors, to change their lifestyles, and to see the connection between small changes and health. Health
Yeah,
is everything.
a connection point. Yeah. So with the nursing, so you pivoted to bedside nursing to more of that clinical informatics. Tell us more about that. Like, how did you decide to make that shift? Because that's pretty unique.
Well, I shared my parents were divorced and both of them were entrepreneurs. So my mother was an interior decorator, my father was running restaurants and other small businesses. And when you raised in that environment, you get that little bug. And so you're right, I was working in bedside nursing, and I had worked in the acute hospital space. I pivoted to the post-acute skilled nursing space, really fell in love with that portion of the healthcare continuum and its vital role in receiving very sick people from the hospital, continuing the healing, spending a bit more time with them than in hospital, which I liked in that sector, and seeing them home. So here I was in that role, and I was doing speaking. I was, talking about restorative nursing and the kinds of techniques that we as nurses, we as caregivers do to foster independence. And we have to be careful that we don't foster dependence, right?
Mm.
Even in our nursing organizations, the concept of getting everything done quickly in the morning at a very busy unit will foster a lot of dependency because you just do things for people because it's quicker, but
Right.
that's not helping them. So I was doing a lot of speaking about restorative nursing and these principles when I met an organization also on stage that was talking about some data automation and starting to digitize and get off paper one key component of the assessment that is done in nursing homes called the minimum data set.
Mm.
The nursing home industry is really data driven. People don't realize this, but there's a comprehensive assessment which is completed every 92 days on every person who lives in a nursing home. And that data is used to build a plan of care that the entire team is going to do in order to care for that person. And I was so impressed by this standardization of data, but we were doing it on paper.
Mm.
And, at the time, the world was starting to think digital. And the government was thinking about electronic submission of this data. So there were new companies emerging. And that's how I pivoted into clinical informatics, was as a subject matter expert and a clinical director who knew the operations and the systems. I went to work for a technology company that wanted to digitize those processes. And bring efficiency and start to build reporting off of this standard set of data. So it was, you always, like I say, your path will find you, right place, right time, had the had the interest and the curiosity about small startups and took that leap,
Mm.
knowing that I could always work 12-hour shifts on the weekends if anything went wrong.
Exactly, exactly. Oh, I remember that very vividly. I was working on a transitional care unit, and I remember the shift from going to paper to when we started to transition to more of that digital technology platform. And it was this huge change, and it was so much more efficient to your point. The data that we were able to capture. So yeah, I remember all of that.
And today we're leveraging that data and more. The technology has supported healthcare organizations to put more and more processes off paper into a digital environment where data can be transmitted and shared and replicated. And if you remember, we would admit somebody and there was 117 pieces of paper that you would write their name and room number on the top.
Yeah.
This is ridiculousness. We need humans to do much more important clinical work than copying.
Right.
And so technology, brings that efficiency. It's an exciting part of the work that I do, such that I feel like I get to give back to
Mm.
nurses, precious time
Yes.
and intelligence, right? Because information in motion that's moving to the nurse at the time the nurse needs that information, really valuable to the new nurse, the young nurse, the agency nurse, the tired nurse, the overworked nurse, which is all of those nurses. That's all the nurses. And yet we want to find a way to help them see what's in the record by, again, using some modern technologies, some artificial intelligence technologies to surface that information and make it part of the decision-making process so we can, get better care outcomes. So it really was an exciting pivot. And I
Mhm.
feel like I'm still riding that wave, 20 years later. It's
Oh,
still
yeah.
ever exciting.
Yeah, that's what's so cool with tech. It's constantly changing and evolving. You brought up the term artificial intelligence. Just so curious, how are you seeing AI really excel in healthcare, and what are people adopting in ways and being able to alleviate some of those maybe other burdens that they had
I
navigating
think
some
we're
of those charts? Yeah.
Yeah, we're really, really, really on the edge of just stepping in as fast as the generative artificial intelligence space is changing, where you can, ask Chat GPT and it's going to spit out an answer. In healthcare, we need to be a million times more careful. So there's a risk in those large language models that they just hallucinate and generate the wrong answer. We don't
Yeah.
want any of that in healthcare. So there's definitely room for machine learning and large language models in the healthcare space. It's what I do full time as a principal product leader in artificial intelligence. The the opportunities to build, like you said, to make predictions that are more accurate than a human.
Mhm.
Yeah, think about that for a second.
Yeah.
First of all, humans, we're not that great at predicting. We think we are, but we're not. We have biases that make us very wrong.
Mm.
And algorithms that look at millions of records, they can be more accurate in some of those predictions than humans. Not that they in any way take the place, and you heard me say it a few moments ago. We want to surface kinds of concerns and predictions, combinations of data which we can see in that pattern analysis is of concern. I really think, to be very honest, that's all diagnoses are. We have diagnostic groups only because as humans over decades, we've recognized patterns of how an illness presents. And we follow that pattern. We say, yes, this pattern means diabetes.
Mm.
And this pattern doesn't. This pattern means something else. Machine learning just uses that same data, but the algorithm can look at pattern recognition. They can compress years into moments
Mm.
and see a pattern and compare your today's information to a pattern of information that might represent 20 years of seniors. and raise a concern to today's nurse. And that is so powerful and
Oh,
so exciting.
it is.
That and that's real. That's real. It's again, it's slow. We
Mhm.
have to do it with what we call responsible artificial intelligence. The Health and Human Services and the Office of National Coordination, has put forth rulemaking that certified providers like mine follow in delivering that. And I think nurses and doctors, we have a huge responsibility to get in and learn, to
Yeah.
understand what these models can do and what they can't do. Every model will have its limitations. Every person who's putting out a model is going to say where the limitations are, and everyone who's going to consume it needs to ask those questions. If we do it responsibly, there's going to be a lot of value to the health and well-being of humans. Again, I don't see this as any different than what we do with our human minds.
Mhm.
I just believe that we need to be responsible, transparent, really explain it, and allow practitioners to utilize this kind of technology
Right.
alongside their clinical decision making.
Yeah. Yeah. I like that as a companion to what we're doing. Yeah.
Augmented, and we talk about it as augmented intelligence, not artificial intelligence.
I like that. I haven't heard that term before. That's
Yeah,
good.
the president of the AMA, really, I hope I'm giving that credit properly. It's the first place where I heard it,
Mm,
and it's really penetrating the conversations around how clinicians will utilize
mhm.
these algorithms, these, again, forms of intelligence.
Yeah.
And, having a human who has been trained and has some intelligence interpreting the output is really helpful. It's necessary, it's essential. Otherwise, you could have an error and not know it.
Right. Right. Oh, so fascinating. It really is. And you wrote a book called Prepared, a Healthcare Guide for Aging Adults. And I like that this is such a comprehensive place to start about how do we ask questions when our care is changing, when our health is changing, what do we need to know? There's so many questions that families have. And when you've talked with caregivers and even in your own experience, what are some of those essential questions that we should be asking ourselves when we're not only seeking care but providing care? What have you found to be helpful?
Well, ask yourself this.
Mm,
Are you ready for a sudden change in health? Is the next person closest to you ready for you to
mhm.
have a sudden change in health? I know none of us want to think it's coming,
Right.
but there are very busy emergency rooms all across America for a reason. This
Yeah.
stuff happens every day.
Mm,
So when you think about that question, what would I need to be ready?
mhm.
Again, what information about yourself, your medications, your history, your insurance, your wishes, your wants, your preferences. Does anyone know that? If
Yeah.
you're the only one with that information, it certainly will not be carried out in a healthcare setting.
Right.
Knowing that the settings are all disconnected, your primary care doctor is never at the hospital. Some people say, oh, my primary care knows exactly what I want. Great. But they're not in the emergency room. They're not in the hospital. They're not in the rehab. They'll see you when you get out of all those 4 to 6 transitions,
Mm,
and your plan will have changed dramatically. So, Nicole, I wrote that book from observations and experiences. Again, I'm a nurse. I worked in the space. I work in clinical informatics. I work with technology that should be bridging these gaps, but isn't. And then I enter the healthcare system as an advocate alongside my mother-in-law, my mother, my aunt, my father, when you're the nurse in the family, you're guiding your neighbors' friends. You become
I go
the phone
to.
call. Yeah, hey, can you look at my kid? Should I stitch him or not? Like that happens all the time to nurses. The challenge for me was that there were large gaps. What I knew should have been happening and communicating and clearly transitioning. And when it wasn't, I was filling those gaps.
Mm,
I was seeing those gaps and I was developing a system.
Mhm.
fulfilling them. And so I got very good at having a loved one in the healthcare system because I completely modified how I behaved. And I did that behavior day after day after day. And I started teaching that behavior to the spouses of the people I was supporting. And when I had a really bad experience, I will be honest, with at the end of my mother's life, she was in 6 months, never home, 14 different hospitalists, in and out of facilities, too many mistakes to count. And at the end of that, I said to myself, I really need to write a book about this. People need to understand what they're about to experience. If you know what's going to happen, like me, you can come in with a system and an advocacy approach to manage. But if you go in with a whole bunch of assumptions and they're all wrong, then all you're going to feel is frustrated, overwhelmed, confused, and really disappointed with the healthcare system because your assumption is that one person is looking after you from beginning to end. That's just not correct. The
Right.
system really can't do that. You and your loved ones can do it. And that's what I teach people in Prepared. I teach them a system of advocacy. I teach them what's going to happen through those 4 to 6 transitions following a sudden change in health. I make it kind of like a recipe, check boxes and tips and things to do, and just leave it on your bookcase because the next time it happens, you're going to need, just like a recipe card, you don't remember every little ingredient. And if you miss one thing, if you forget the baking soda, that whole thing doesn't come out right.
Mhm.
And when I forget and miss a step, things don't come out right. Even when I was editing the book, my own father was back in hospital and I was following my system. I was making my call every single day, asking my standard question about his ordered medications and when he had last received it. The first day I got the right answer. The second day I didn't get the right answer. And I thought, well, that's strange. How is that his Coumadin is not on his orders? And, you know, my own imposter syndrome came.
Mm.
He was in for COVID. He has a history of AFib. There was no reason in my mind that he should be off his Coumadin. But you know what I didn't know? Gosh, maybe we're not using Coumadin with COVID. Maybe there's something I don't know. So I asked, could the doctor call me? And I didn't get the call. And I called again the next day, still not back on his Coumadin. Finally, get an answer. It's a medication omission. It's a mistake. We're sorry. We're going to restart it. And it didn't restart for another day. And that error was picked up not when he stroked, not when he had a TIA, but it
Mm.
was picked up when I called and followed my system of advocacy and asked my daily questions. And just like the baking soda in a recipe, if you miss that one step, I'm getting a call later in the week that says your father's had a stroke. And I'm like, wait, how did that happen? He's on Coumadin. And then we discover the medication error. And that's why I wrote this book. I wanted non-clinical and maybe clinical, but not expert in senior care, not expert in transitional care. And I spent 35 years reading emergency room notes, hospital summaries, and transitioning people into senior care and getting them home. So that's my area of expertise. And I wanted to dump everything I knew, all my tips, all my tricks into a book that was simple and easy to follow, like a recipe, so that the 60 million Americans in this country over the age of 65 and their advocates could
Mhm.
have access to expert information at their fingertips and smooth some of those gaps. I trust me, the last thing I wanted to do in my life was write a book. I'm a talker, not a writer.
Oh, well, here we are. Isn't that how it comes together? And what an incredible tool. I think you said the key word simple and easy to follow. We really need to be able to things that we can pull and easily find what we're looking for because most of us don't have that healthcare background. So being able to have the guide, the knowledge is really, really what it's all about and just so incredibly helpful. If you're a caregiver, you know how challenging it can be to keep all of those balls in the air between caring for a loved one, managing appointments, and trying to squeeze in time for yourself. It's easy to feel overwhelmed. And I used to feel like I was just going through the motions, powered by caffeine, and never truly focused. That's when I found Magic Mind. Magic Mind has been a game changer for me. I have been using it the last few days, and it not only tastes amazing, it is more than just a drink, it's a moment of clarity in my morning. Since I started using Magic Mind, I've noticed a big difference. My mind feels sharper, my focus is clear, and I'm not just surviving the day, I'm engaging with it. I'm able to give my full attention to the people that I care for while also taking care of myself. If you're ready to reclaim your focus and feel more present in your caregiving journey, I invite you to check out Magic Mind at magicmind.com, and you can use the code Navigating the World 20 for 48% off your first subscription or 20% off a one-time purchase with this code at checkout. Let's support ourselves so we can better support those we love. It is.
Yeah, there you asked about questions, and I ask a lot of questions in the book. I tried to put questions that I remember hearing at that point. So, when you're getting ready to go for a trip,
Mhm.
you start thinking about the trip, you start packing, you start to imagine what it's going to be like when you get there before you arrive. And I tried to use these kind of analogies when you're in the hospital and you're needing to go to rehab, but you don't want to go. Like it's, even maybe on a trip where you want to go someplace and your husband doesn't want to go and you're like, "Well, come on, it'll be good." You're talking you have to sell the pros. Here's the pros of rehab. And how do you pick one? These are the questions that people are going to ask. So I put it in the book and help them actually think through how to select that facility and how to even understand and interpret the rating system of the facilities, because the rating system is, well, it's not a Yelp review, let's be honest. There's actually no feedback from consumers in the five-star rating system. And there's some things that the government does that sort of forces a distribution within each state, that means that in every state in the country there will be nursing homes at 1 and 2 stars
Mm,
because they're forced to be.
interesting.
And they take the performance of the state and they stretch it, so that 20% in every state are a 1 star coming out of like there's three things that go in, but the very first step takes 20% of those facilities, brings them to a 1 star, and then they have an opportunity to maybe earn one more star in quality or staffing. So the nursing home really close to you that your best friend recommended might be a 2 star facility. And the social worker might be saying, "Oh, I don't know. You want to go to a 2 star restaurant?" Right? The way we interpret that 5 star rating is not well understood. The reality is, I wanted people to better understand that 2 and 3 star buildings could be perfect for you if what you need, they're good at. And
Ah,
they're close by and they have a strong rehab program and you're comfortable there. Like, don't discount that. Furthermore, 5 star facilities are, 10 to 12% nationwide. You're not going to get into one of them. Even if you can find one, they're not going to have a bed.
interesting.
So, thinking about how I select from a 3 star building or a 2 star building, and looking a little closer at what information is online about what they do really well and what you need, that's a simple way of choosing a facility.
Right. And how to know to where to find that. So where do we go if we're looking for what's the rating system and how do we discover that?
Yeah, the US government posts that on carecompare.com. And you can actually compare any health provider on that website. So you put in your city, your town, the provider you're looking for, and then you can see, that rating system. And again, in the skilled nursing space, there's three major components that they score. Their health inspections, when the inspectors come from the state. They score quality measurement and they score staffing. And so I encourage people to, do a little bit of, get in your car and go visit. Like that's I think the most effective way. If you're looking at a facility, I hope it's within visiting distance of your home, because getting those visitors means a lot to your loved one when they're healing and recovery. So if it's within visiting distance, go visit.
Yeah.
Take a walk, use your eyes, use your nose, use your heart. Do you see smiles? What does it feel like to you when you're, going in on tour? And, also, I tell people, remember what you're going in for, a short period of time for some additional skilled nursing and some skilled therapies to be provided to you. And I help them to think through those needs that they have that are harder to schedule. You don't know when you're going to have pain or when you're going to need to use a bathroom. And if you need help with those things and your family's not capable, really capable, then go to a short stay, spend a week or two. It's not, it's an investment. I talk a lot of like a little stock. You don't want to take that stock out too soon. Let it fully mature, get all you can out of it and then go home. It's an investment in yourself and you're worth it.
That's such a good way to look at that. Wow, I've never looked at it that way. Thank you. Looking at understanding, I think the healthcare costs can be so daunting for us. Not only the different systems, but also there's a large financial, you were sharing, investment, and also that can be unexpected. So, for families, as they're looking at navigating whether it's Medicare, managed care, what are questions that you see? What should we be aware of? All of that whole healthcare financial piece.
As complicated as it is,
Mhm.
there's some pieces we can simplify.
Mm,
So, over 65, we have an insurance policy in this country. It's an entitlement. You get to 65, you're entitled to insurance. Now, whether you're going to pick the Medicare we call traditional or original, and that people think of, or you're going to select a managed Medicare or what we hear as Medicare Advantage, that choice technically will come to you only after you've enrolled with traditional Medicare. So every person, when they come to 65, if they want it, excuse me, can go into traditional Medicare. If you're working and you have comprehensive coverage through work and you want to stay on that plan, no problem. The government wants you to tell them that at
mm,
65. So you can't be late. You have to communicate 3 months before, I think, 3 months before your 65th birthday. You got to tell the government, hey, I already have it. It's comprehensive. See you in a few years, or I'm coming onto your plan. Thanks for having me. And everyone who comes in will go on to a traditional Medicare. Once you're in, you can decide if you want to go traditional or managed, but you don't just come in to manage. So while it's complicated, the doorway, the entrance is still the same. When I teach a lot on this topic, and when I talk with people, I will ask them some kind of dichotomous types of questions. Do you travel a lot? Are
mm,
you all over the US and other countries, or are you pretty, stay at home, not looking to go anywhere? Do you have a lot of specialists that you love that you would never want to give up? Because when you choose a Medicare Advantage plan, most of them want you to stay with their doctors and stay in their network, which means you're sticking around. Not all, but most. And if you need services, because let's be honest, they're paying the bill and they are in fact trying to make a profit. If you need money, if you need a service, you're going to have to ask. Kind of like when you were a kid and you wanted to go to the movies. You would say to your parents, "Hey, can I have 20 bucks for the movies?" And your parent would decide if they were going to authorize that spending. You
mm,
don't really need a movie. And so the authorizations process and getting things authorized and prior authorized, and for those of us in commercial plans that are still working, we know this. It's daunting.
mhm,
It's frustrating. I would say that even in my own family, that frustration has led to delayed services where, my loved one is like, I'm so tired of this. I'm just not dealing with it. So they would The doctor would order an MRI or a CAT scan. The insurance would deny, and then they would make you start over, and so the person would just not restart until the symptom raged its head again. So I actually think from again, health promotion, illness prevention perspective is a terrible approach,
Mm.
because the deeper we get into a clinical problem, the more costly it is usually to correct it. But by denying services, people get frustrated, they push off. Anyway, so when I teach about this, I kind of ask some basic questions. And I also ask about funding. How comfortable are you financially? Because with traditional Medicare, there are co-payments. And if you go to the hospital, every time you go, there's a copayment.
Mhm.
With a managed Medicare, you will not have, you'll know the ceiling of your costs. And
Mm.
after that, you'll pay nothing. You won't need a gap plan because there's no gap with managed care. What I find people are most confused by is how this could possibly work. How can I get free vision and free dental on this managed Medicare? It sounds so easy to give me everything. Everything's free. Well, not exactly. The
Mm.
government's paying them a per member per month from the contributions you've made. So they all already getting paid. They're getting paid a lot. And their job is to promote and invest in health promotional events, which is why we're sending them to Silver Sneakers. Let's get everybody moving. I
Mm.
agree with those things. That's great to prevent illness. But that's why managed Medicare organizations are offering additional services. They are paying for them. The government has allowed them to offer those additional services. But again, they're receiving a per member per month fee. Their goal is to keep you out of the hospital, keep you from spending a lot of money where things are very expensive, and keep you where cost of care is lower. And they will move you very quickly, as quickly as possible, to the lower cost of care. Where traditional Medicare, you won't feel that pressure. There isn't someone looking at every single case trying to make a profit. Um, so there's pros and cons.
Mm.
There's pros and cons. And I think people just need to, think it through. What I do see sometimes, Nicole, is that healthy people are going on to managed Medicare. They feel like they're saving dollars. They're pretty healthy. They can travel nationally, internationally, pretty low risk, and not really think they're going to need anything. But for some people, when care becomes very expensive, end stage renal, oncology, some of the managed Medicare pharmacy plans, the formularies, the drugs aren't on the list that you need. And those folks change back to traditional Medicare, where they feel that they have access to more specialists, more medications, more of the high cost drugs, different tiers of drugs that may not be on the formularies of managed Medicare. So sometimes and that's the irony, it's the sickest of patients who are coming back into the system where the government's paying the bill,
Mm.
and those high cost, lower cost patients are on managed Medicare. If you kind of listen in to what's happening, if you listen in, these insurance plans are stepping out of Medicare Advantage. The margin just isn't there, right? I think I just saw that either Walmart or CVS was closing some of their clinics.
Love that.
And they said right in the press release, we're not making the profits we need.
Mhm. Yeah.
Okay, wait a minute. You
Yeah.
know, it's a business. It is a business. And if the margins can't be made, organizations are stepping
Yeah.
out. And so those those people where costs are really high will come back to traditional, where, in our government system, I guess we balance the budget, shift things around, you know, or inflation goes up.
Right, right. So you had mentioned that there are one of the questions you get. Are there any other common misconceptions that people have about it that you just really hope they know more of the breadth of the value of the information there?
The there is oftentimes confusion between the parts
Mhm.
Part A, part B, part C, and part D. People think they're going to have all four parts. And I'm like, I kind of like, nope, it's like algebra. A plus B equals C. And everyone can have D. Like we put a
Yeah.
parentheses and D gets distributed over everybody. Like I try to reduce it to something you might remember.
Mhm.
So I think that's a common confusion is that people don't understand that when you choose a Medicare Advantage plan, that is what we refer to as Medicare Part C. And it is intended to give you all the services you would normally receive under parts A and B, again, through a contract with the federal government. These insurances are to provide you those services and write the check for those services out of the per member per month money that they do receive from the federal government.
Mhm.
And the game for them is if they can do it at a profit, they can keep the profit.
Right.
There
Yeah.
are rules about, certain percentages of 85% of those dollars, I believe, have to go back into direct care, which is why I think you see things like let us please add a service like vision, let us please add a service like dental. Now we know how critically important our senses are for health,
Mhm.
being able to see and hear and have good fitting teeth and to speak comfortably and to chew comfortably. That's all so important. I'm not saying it isn't. I would love to see those services as part of traditional Medicare, and there have been legislation brought forward to do that, but it does have to go through Congress,
Mhm.
and we just know they're not getting much done.
Yeah. Mm.
Like
Oh, it's
so
so
when people say to
frustrating.
me, why can't I have my teeth cleaned on traditional Medicare? I'm like, listen, just go to the dentist and pay for it. Like you need it, go, because you're waiting for Congress to move. And it's been introduced. It's a great idea, just hasn't gotten over the finish line.
Right. Is there ways that we can support that movement or what's your advice
Oh,
on
that I don't know enough about that. I don't know about enough
that?
about how to get that's I leave that to the regulatory and
Yeah.
government affairs people. I think it's hard to get, pieces of legislation through the system. I do, again, we know that there's a strong correlation between oral health and overall health. And I know myself, if I'm on a conference call, I'm on a Zoom call, I have a bad connection, I can't see, I can't hear, I'm pretty disinterested pretty quickly. Additionally, I feel confused and frustrated because I couldn't follow along the meeting. Our seniors should not live their lives this way. So, hearing supports, visual support, super important for quality of life and the ability to participate and to function, and even for brain stimulation. There's studies that correlate hearing loss with dementia. Like the brain needs to be busy. That's how it's supposed to function. So I encourage families in planning to seek those services, set money aside for those services, invest in those services. Don't just go because someone paid for it. It's so You've worked your whole life to save this money. Spend it on yourself.
Mhm.
Improve the quality of your life today. I do talk about living through your five senses every day. I think we talked about that once. It doesn't matter we don't know how many days we have left.
Mhm.
And sometimes we do. Sometimes families, are struggling with a loved one who's now been put into hospice and they'll say to me, I don't know what to do. And I'm like, okay, well, just think with your five senses. What would your loved one want to hear, see, smell, taste, and touch? Bring them those five things. Their favorite sweatshirt, a smell of a flower, or coffee, a strong brewed coffee. Or bring them in that CD and the old CD player. Someone must have one. Carry it in and put that music on. Um, Live that day through your senses and live every day through your senses. Even with virtual reality, I think there's so much excitement with virtual reality, and we can transport ourselves visually to lots of places that our mind wants to go. Do that, do that in your day. And that's why I'm a big believer in making sure those senses work. that we can see well, we can hear well, our teeth are fitting, we can taste and chew. Um, yeah. So it comes back to the question you asked about, services and who's paying for what. Don't let that be a reason that you don't get those, go out and invest in those services for yourself. It makes a huge difference in the quality of your life every day.
Yeah, I love that perspective so much.
And I think the caregiver, I'll say I call it a caregiver crisis.
Mhm.
So moving people through hospital quickly back to home, rehab quickly back to home, back to home. Who's at home? And families are unpaid caregivers. Their loved one is really thrust upon them. They're not necessarily medical or have any kind of medical background. And I see the industry moving so quickly that they really fail to forget how little knowledge people have and
Yeah.
how really unprepared caregivers are to caregive.
Yeah.
And yet here comes that job. It's just forced on you, thrust upon you. I'm so deeply impressed. And of course, this is Nurses Week. I'm
Mm.
so impressed when I talk with caregivers about the sacrifice, the investment, not for weeks, months, years, that adult children are making to care for their parents.
Mm.
And for many, they'll say it was a no-brainer, 100%. There was never a question. That's what I would do for my parents. But the toll that it takes on that caregiver has a price. I see them, physically, mentally, financially exhausted. And one of the pieces that when I do planning with caregivers, I talk about the gaps and how many of those gaps they're trying to cover.
Mm.
And we've talked about analogies. I think I say, okay, well, let's pretend this is a play.
Mm.
And you used to be the daughter in the play, and now you're the taxi driver and the nurse and the grocery shopper and the lawn boy and the babysitter and the daughter and the wife and the oh, by the way, you have a job. So now and the professional.
Yeah.
So imagine if you went to a play where more than one human was playing that role. So they come on stage and they're wearing a costume and they're saying certain lines in a certain accent with a certain style, a certain pace. Now they have to go off stage, change all of those things, come back on stage in a new costume, new words, new pace. Think about the number of times that you're running backstage, making a change within about 15 minutes. I can almost see this becoming comical. They're hopping on the stage halfway through a costume change. They forget their lines, they speak from the other character. So when I talk with caregivers, I ask them about how many roles they're trying to cover. And
Mm.
I use my hands like this and I talk about like, this is a good plan. This is a really large gap plan. If you fall out of the picture tomorrow, I know this is crazy. What if you get COVID? What if you get the flu? How big of a gap is it for your loved one to get their care needs met? And from this perspective, let's add to the team.
Mm.
Get someone delivering groceries, there's people you can hire to literally make your meals, portion them out, and deliver them to the house. And folks will say, well, I don't really need that. But if you go out tomorrow, you need that. So when you look at that plan of care for your loved one, look at how many gaps exist when you're not in the picture. The
Mm.
less gaps, the better the plan for sustainability, for resilience. And let's be honest, you're going to be the one when that person calls out and says, I can't pick up the groceries today, or my kid is sick and I can't make the meals this week. You're going to be the one who covers for when they have inconsistencies of delivery, but you should not be the one covering all of those things all of the time. I try to encourage caregivers to be involved in strategic and vision and not execution. Make
Mm.
a plan, make a strategy. Do not be part of that plan. Get someone else, say yes to every one of those people in your social media who have said to you, let me know how I can help.
Yeah.
Right? You put up a post that says, hey, prayers for my mom. We're in the hospital. And 15 people will say, how can I help? And you know what we never do? We never say, you can drive to soccer, you can feed the cat, you can get the groceries, you can drop a lasagna. We never say that.
Yeah.
The other thing I will say, if you're those 15 people, when someone in your network posts that they need prayers or support, think about how you know them. And instead of saying, let me know how I can help, I want you to say to them, would it be helpful if I drove to soccer this week?
Mm.
And the reason that I want you to offer a very specific, something you know to be helpful, is that during a time of crisis, we can't think of what's helpful.
Mm.
When we are the recipient of trauma, of crisis, of sudden change in health, of a loved one, we are so overwhelmed, we can't think of what small things would be helpful. But the network saying, would it help if I did this one thing? And then I tell caregivers, you want to say hell yes to that. Say yes to everything that's offered. And I
Mm.
want the network to learn how to offer what's really helpful. And that piece, I think, builds sustainability for caregivers who are thrown into a role they're not ready for. And it helps to, it really does help. We say death by 1,000 cuts, and this is really life by 1,000 favors.
Mm. My goodness. There's like 10 quotes I'm going to pull out of here and just hang on to. And remember, being a part of the strategic and the vision and not the execution, looking for the gaps of when we're not available. I mean, so many things that we constantly need to be reminded of. Saying yes to the help. I think we need to hear that encouragement. It's so helpful for people that have gone before us, can navigate the healthcare, right? We've got guides that can support us in that. So, with all of that, people need to read the book. And what's coming up for you? What are you excited about? Where can we connect with you? Where can we learn more?
You can always see where I'm going to be. I have an events page on my website, which is www.cherylfield.com, both past and upcoming events. I say past events because oftentimes I loop back and go back to same events, annual events. I'm always excited when I'm able to teach at even small groups. Sometimes smaller is better, the intimate group, where you feel like that 1 hour really made a difference in the rest of this person's life because they've learned a new skill. It's like that, give me a fish I eat for today and teach me to fish I do for a lifetime. I want to teach people to advocate for a lifetime. So I do work full time. I do my advocacy work, nights and weekends and part-time. Where like today it's Nurses Week. I took a day off so I could do an event over at the hospital in my community. And so people can, see what's on my website, where they can certainly join my newsletter. I try to send out a newsletter once a month, and you can get a copy of Prepared. If you want it signed, you can order it right on my website and I'll mail it to you. If you want it the next day, you can grab it from Amazon or Walmart.com or BarnesandNoble.com, any place where you buy books. What I want to do say is it is available in large print.
Mm.
And oftentimes you just have to look for that alternative platform. So Amazon has it off to the right where it says other versions available. And that's where the large print version is available. I really want to encourage our seniors to really read this book and feel comfortable. It's their life. I want them in control. I want them to know they're in control. And that is why it was so important to me that a large print version be available so that even people with visual impairment, which happens as we age, can find this book comfortable and easy to read.
Yeah, so, so important. And I'm so thankful that you're here and how you share, how you teach. It's so digestible for something so complex. I think breaking it down, having the story component, walking us through step by step, it's so important to have that resource. So thank you. Thank you for sharing with us. And
Oh, it's my pleasure.
Are you looking for more support and community? We sure are. That is why I'm so happy to highlight one of my favorite podcasts in the caregiving community, Confessions of a Reluctant Caregiver, hosted by my friends and sisters Natalie Elliott Handy and JJ Elliott Hill. They offer a unique blend of personal storytelling, expert advice, and candid conversations that shed light on the real-life challenges and triumphs that caregivers face. Tune in to Confessions of a Reluctant Caregiver wherever you enjoy your podcasts, or explore more on their website at www.confessionsofareluctantcaregiver.com. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.